Welcome to the Ask the Expert Show with local celebrity hosts Steve O and Rene. Sit back each week while Steve O and Rene educate you with live in-studio experts, such as lawyers, doctors, home improvement, and financial experts in their field. Call in and have your questions answered each week at 888-565-1470. Now, here is Steve O and Rene with today's expert in their field.
Good afternoon and welcome to the Ask the Expert Show, the greatest informational show on South Florida radio. For all of our Jewish friends out there, I hope you had a happy
L'Shana Tova.
You couldn't have said it any better than me. Happy and healthy New Year. And we're so excited about both of our guests today. I'm Steve O, and my co-host sitting right next to me is Rene. Hi, Rene.
How you doing, Steve?
We have a great expert on the show with us today. You know, what we do on the show is we interview top experts in the areas of health, legal, financial, and home improvement. And did we hit a home run on this one?
We really did. Okay, so if you'd like to watch today's show live, go to the website wwnnradio.com and click on the WWNN TV link, and voila, there we are. And if you have a question about home care, call us at 888-565-1470. And if you have a relative or if you're looking for a home care company, we have the best home care company live here in studio with us today.
So let me introduce you to our first guest, Nina Plunka. I like that name, Plunka. The Director of Long-Term Care Insurance at CareGiver Services. Hi, Nina.
Hi, Nina. Welcome to the show.
Thank you.
Did you find it okay? Was
I
it
did.
hard?
No.
It's so easy to find this
It really
station.
is.
Very
so
easy.
tell us about CareGiver Services and what areas you cover in South Florida.
Sure. CareGiver Services is a multifaceted healthcare company. We have 12 offices around the state. With those offices, our main core business is our nurse registries, and where we will send out caregivers to provide care to clients of all different types and all different needs. Also within that company, we have another subsidy, which is our home health care agencies, which actually provide care to clients under the Medicare and Medicaid system.
Wonderful.
What's the difference between registry and the home care?
Well, the basic difference is the home care agencies will provide higher skilled care and physical therapy, and the nurse registries will provide caregivers to provide services from companions, drivers, homemakers, all the way through home health aides, certified nursing assistants, LPNs, and registered nurses.
Okay.
So you cover Broward, Palm Beach.
We cover Dade, Broward, Palm Beach is our largest location, but we have 12 offices: Orlando, Tampa,
Oh, wow.
on the West Coast, Fort Myers,
They're
Sarasota.
all over.
Yep, and the villages.
Well,
So how
this
does the-
station is so perfect because, first of all, we have an older demographics that listen to our show.
Right.
But you also work with children, too. Is that right?
That's correct. The one entity under Caregiver Services is our PPECs, which are Prescribed Pediatric Extended Care Centers. And basically what they are is a high acuity daycare center for really sick kids. So within that system, the children can come to a place where they can be cared for all day long.
Oh, this is not in-home.
No, this is not in home. This is it's like a daycare center. It looks
Right.
just like one. As a parent, it's very heartwarming to be able to bring a really sick child someplace what's considered normal.
And what ages?
They're from birth all the way up to, I think it's 18, I think it was what it is. And they're fully staffed, nurses, therapists, and it allows the parents to work, which is really the key, so
Right.
that the parents can get back to work and know their child is being cared for.
So how did CSI begin?
CSI started in 2000. It was a small little company in West Palm Beach called Friends Assisting Seniors, and a small entity actually in Tennessee that came together and became CSI.
That's why you have locations in Tennessee also.
Well, we have a small location in Tennessee, and then when they came to Florida, obviously there's a need. And so through acquisition and our internal growth, we grew into what we are today.
I like the CSI. It's like
Yeah.
a TV show.
Yeah, free advertising.
Right. So tell us some of the services that you offer.
Well, People call us for needs, depending upon what their needs are. Some people just need transportation to a hairdresser, doctor's
Right, they
appointment.
just can't drive anymore.
They just don't drive. They can't drive. They're
Right.
not allowed to drive.
They shouldn't be driving. Exactly.
And so they call in for that. There's no minimums, really. They can just call in for whatever services that they need. The majority of our people, though, are more than that. They are having inability to bathe, dress, get up out of bed, get out of the chair, prepare meals. So then it becomes more hands-on care with our home health aides and our certified
Right,
nursing
and this
assistants.
is in lieu of going into like an assisted living
Correct.
facility.
Well, everybody wants to stay home.
Exactly.
I've yet to see
I
someone.
want to say there's a lot of people who are listening right now and watching the show. Their parents are getting older,
Right.
grandparents, and instead of Googling, that's what the purpose of this show is. That you don't have to Google, because when we got the call from Caregiver Service, I was so excited, because if I know who you are, then that means you're good, because we've worked with home care companies for the last 10 years.
Right.
And
So
that's a
I was
great
really
segue
excited.
also. Give everybody your phone number
Sure.
and your hours.
Right. Well, Caregiver Services has a live call center, 24 hours a day, 7 days a week.
Wow.
We have no
That's
holidays
incredible,
and no
yeah.
answering service. You actually speak to a live person. The number is 877-CAREGIVER.
Oh,
which
that's
is
easy.
Very easy.
That's real easy.
So how do you determine the type of caregiver a family needs?
We have intake specialists that are in our Miami office, as well as locally in the areas that the offices might be. And really, truly, we're just good listeners. People call in and they are either very specific in what they do want or what they do need, whether it's the client themselves or a family member. But then some people don't know what they need and they don't know
Right.
what they want. So it's our job and our responsibility to talk them through the process to elicit from them what exactly it is that they need.
And then you make that determination whether they need somebody more on a
Full-time
full-time basis or
hours,
part-time.
right. And the glory about CSI is that you could start out with a couple of hours. Some
And then
people start
increase
out
it,
just as a
yes.
transportation or a driver or a cleaner. And then the next thing you know, something happens, there's an episode, and now they need somebody more. So then we just increase as they increase.
You know, I've noticed that it seems like a lot of the daughters take care of the families. Is that right?
Well,
it
it's-
seems like everybody I
yeah.
know, it's the daughter, not the husband.
But the problem is that a lot of people work.
Well, that's the problem with a lot.
Yes.
I mean, myself
Especially
included.
a lot of women in the
right.
workforce.
A lot of people are in the workforce. A lot of people, unfortunately, husband and wife both have to work. And there's a lot of people who have children that they're caring for, and then their parents that they're caring for. So they're stuck in the middle. So it allows them the opportunity at a reasonable price.
It gives them a break.
A break, you know,
Right.
because and the truth is, you know, I have elderly parents, and I don't want to help them bathe. You know,
Right.
I understand that.
I,
No, that makes
I just
sense.
don't. So I would be okay in paying somebody to do that because then I can be the child and not, you know, be the caretaker. And that's hard. Some people have to do it and some people don't.
How do you go about the screening of the caregivers?
Well, Florida has very strict laws. We're
Good.
actually
That's
very
good to hear, yes.
Yeah, we're a very progressive state when it comes to the elderly.
I think it's because we have so many elderly in the state.
Probably. I'm thinking that's probably true, but we do level 2 background checks on everybody, which
is what?
Fingerprints. Okay, everybody gets fingerprints, everything gets to the state, and it is determined whether or not from that, whether they're able to work or not able to work. So there's really no guessing to it. It is or it isn't. We do the background checks, we do their reference checks. We don't just take the facts or, you know, it comes through the machine and we don't know who. We actually call and we confirm and we make sure that they've worked continuously. They have to have a health check within the last 6 months to make sure that they're free of communicable diseases. Such a
That's
hard
nice
one to
to
say.
hear, yes.
Well, it's important. If
It
you're
is,
sick, you don't
really,
want someone
yes.
sick coming into your home.
Well, especially
So-
for the elderly anyway.
Right, they're already at risk.
Yeah.
So we also, which is a company rule, every area director for every office throughout the state has to physically meet the caregivers. So it's not a clerk sitting at the desk saying, yeah, you have everything you need, great, you go to work. That area director who is responsible for that business actually meets that caregivers, makes sure that they can speak the language that they're going to be placed at the person with. And it's not always English. Some people ask for Spanish. Some
Right.
people ask for other French, Hebrew, all kinds of languages. So truly we're matchmaking. We're matching the needs of the client with the caregiver's expertise, and we put them together.
So I have a question. So if you send a caregiver over to a family, and do they get to select who they want?
Absolutely. We do interviews. interviews. If the clients ask for them, we offer it when we do the intake process. Some people don't care.
It's like J-Date.
Yeah.
No, because I'm saying that because I know a couple of instances that people were not happy with their
Right.
caregivers, and they went through a few of them.
Right, and that happens. I
Yes.
mean, that's one of the
Personalities,
It's a,
yes.
Yes.
it's a matchmaking. So, but with our company, we do offer clients, if they're not sure of what they're looking for, or even if they're on the fence about having somebody, we let them interview people, 2, 3, 4, as many as it takes, and we'll interview wherever. If they're in the hospital, we'll interview there. If they want to come to our office and interview, if they're not comfortable with having a stranger in their home, then they come to the office and they can interview there. So that makes the choice theirs, and there's a lot less, confusion because they're actually choosing.
What if somebody wants to break in, become a caregiver? Is it hard to get into that?
No, I mean, from the lower levels, there are some schools out there still that are offering the home health aid, which is a certificate, not a licensure. And you can start out at that level, and then, caregivers work their way up. They get the certified nursing assistant, which is a state test that they have to take. And we've had caregivers go all the way up, become RNs.
Wow. So what are they able to do instead of just a typical RN? I mean, blood pressure and stuff like that.
Well, it depends on the level of the caregiver
Yeah.
that's coming. The companions and the homemakers don't do any real hands-on care. They're not there for that. They're truly companions, reading to clients, taking them for walks, driving them to appointments. Certified nursing assistants and home health aides in the home are seen as the same. So they are there to bathe, dress, toileting, transfer, up and out of the chair. They prepare meals, and they keep the area where the client lives neat. So they're really not there to do like major cleaning, doing the windows and stuff like
So they
that.
just tidy up a little
Right.
bit.
So if
Yeah.
you're taking a shower, they're going to make sure that the bathroom is dry after you get out. If they help you with a meal, they're going to make sure that the dishes are put away and the linen's
These are
changed.
actually professionals.
Yes.
Wow.
Yeah.
That's great.
Yeah, they
It really
are.
is.
Yeah.
Now, what if someone right now is using another company and they go, I love how this company sounds. Is it hard for them to switch over?
No, the truth is that home care is a patient's choice. The client has the choice to choose the home care of their needs. And
So there's no contract. So you could just cancel somebody at any point
You
and
just-
hire
yeah.
whomever you want.
you just call up and you say, I no longer need your services, and then
that's
you
it.
call
I heard
whoever
about
you want.
CareGiver Services on the Ask the Expert show, and I want to go with them.
I heard about them through a family member because I said my uncle actually uses your services and he loves his caregiver that comes to the house.
That's awesome.
It's been
That's
using
good
you
to
guys
hear.
for years. Yes.
Good.
That's amazing.
Yeah.
I mean, what's the chance of that happening?
Yeah.
Is caregivers, is it covered by the insurance?
Caregiver. Well,
And that's your
That's my expertise.
yes.
Yeah. So long-term care insurance is a product that people buy above their major medical, Medicare, or their HMO. We cover all of the insurance companies, and it is covered, and it's not hard to file a claim. There has to be 2 of 6 ADLs, which are activities of daily living, that the clients need to trigger, which is bathing, dressing, toileting, transfer, continence, and actually eating. Not meal preparation, but eating. And if you trigger 2 of those, then you file the claim for
Then
the...
you're eligible.
And we do all that.
So
We
people
help
should
them.
actually look at their insurance policy because they might not even be covered for something as important as this is.
But wait a second, how about Medicare?
Well, Medicare's purpose is for skilled care. It's for the skilled nursing to come in for wound care or diabetes or physical therapy, occupational therapy. They don't cover custodial care. They're not there to help you with your bathing and your
So if
dressing.
you don't have additional insurance,
Right.
it's not covered.
Right, you would need this. So for the younger people or for the elderly people that are listening who have children, long-term care insurance is best bought when you're younger and you're
Yes.
healthier. It's less expensive, but it is
That's important.
amazing
Yes.
to have.
Let's go to break right now. When we come back, we're going to talk about what happens if a person's hospitalized during this. And when we come back, we're going to have more with Nina Plotkin.
CareGiver Services is the most trusted name in caregiving in South Florida. CareGiver Services offers skilled nursing, assistance with activities of daily living, shower or bath visits, meal preparation, housekeeping, companion homemakers, live-in care, special needs, and many other areas of home care. Caregiving Services also provides care for Alzheimer's and dementia patients, as well as transportation for doctor's visits. Caregiver Services conducts extensive background screenings, including Level 2 background checks. Caregiver Services accepts long-term care insurance and Medicare. Contact Caregiver Services today at 800-282-6409 or go to their website at CSICareGiver.com. Trust the care of your loved one with the home care company that so many trust. That's Caregiver Services, where caring comes first. Call them now at 800-282-6409 for peace of mind.
And we're back with Nina Planka, Director of Long-Term Care Insurance at CareGiver Services.
Okay.
Okay, we're back.
We are back.
Okay, so is transportation, we were talking about the children, is transportation covered for the children that come to that, I think it's called the
PPAC, the
PPAC,
Prescribed Pediatric Extended Care, yes. Transportation is provided by either the state, if they are signed up for state transportation, or the PPAC staff does pick up children and brings them to the facility.
What kind of staff care, like for the children, they're all licensed also?
Absolutely. The PPAC is...
What is their background? What kind of training have they had?
Well, there's a ratio of children to staff. There's an RN usually there, well, always there. There's a doctor that's there. The nurses have to have at least 1 year experience with acute children. Because these are not
So this is for acute illnesses. This
Right.
is not because I have a child with autism.
Right.
It's not for children
No, and
suffering
it's not
with autism.
behavioral. It's not
Okay,
behavioral
nothing
issues.
okay.
No, these are medically
Medically sick
needy,
children.
Give
really
us some
sick.
ideas.
These are children that are on respirators. These are children that that need to have constant monitoring of their breathing, of their medications. These are really sick kids.
Yeah, and I know Medicaid also covers some of that.
Right, and that is covered. That's what this is covered under.
Oh, it's covered
and
under
because it's
Medicaid.
allowing the parents to work, and that's the whole purpose. Is if they can't work because they can't leave their children, then how are they going to survive?
Me, I get it. Yes.
Right. So that's what its purpose is, and it's amazing if you ever come to one of these.
Where are they located?
Centers.
Where do you have?
We have one in Dade, we have one in Broward, we have one in Palm Beach County, in Orlando, 2 in Jacksonville, and we're actually opening 2 more in Dade County.
What a great concept. It really is.
Very
So our
heartwarming.
listeners in Stewart, Martin County, they would go to the Palm Beach facility.
Right, and
Okay.
in time, I'm sure that there will be more PPACs throughout the state, because that is our goal, to open more. There's a need. Unfortunately, I hate to say that, but the truth is
There
that
is a
there is
need,
a
yes.
need. There is a need, and it just helps parents have a safe haven for their children to be, so that they can have peace of mind and actually work.
Right.
Let's give everybody your phone number again.
Sure, it's 1-877.
She never calls herself.
Caregiver. 1-877 Caregiver.
Okay. Now, I'm going to really put you on the spot with this one.
Mm-hmm.
What is he going to ask me?
Just getting the notes.
We were talking before the show. There are so many home care companies.
Right.
I think we Googled, there was like 12 pages. I mean, that's like a nightmare to someone who's looking. Why should someone go with Caregiver Services over anyone else?
Well, my experience in 20 years of doing this, of doing home care, is exactly that. Choosing a caregiving company is not a billboard. It's not a magazine ad. It's personal. So you're going to go with people that you trust and that have either used services of that company, or a doctor that's used services.
A recommendation,
Or a
yes.
recommendation from somebody that you know. CSI has put its foot first, because we have 24-hour call center. We don't have an answering service. You don't get a beeper. You don't get called back in the middle of the night. You always get a live person.
And that's important.
That's huge.
Yeah.
If you're a senior and you're in need of something and you want to call, you can't wait to have somebody call you back. So that's huge.
So somebody-
Seniors
let me
hate
just-
the buttons.
Yeah.
Yeah,
Press
they-
1 for this, press 3 for this.
So if somebody called you in the middle of the night and said, I need somebody to come out to help
Yeah.
me, do you do that? You
Of
send
course we
somebody?
do. Well,
You do?
we staff a lot of the hospitals throughout the Tri-County area, Dade, Broward, and Palm Beach County. So we do a lot of hospice work. We have a lot of contracts with hospice companies. So that's not a 9-to-5 job. That could happen at any time.
Yes.
So we do have a whole set of caregivers that are prepared and ready to be working at any moment. And we pride ourselves that we can get a caregiver out to somebody within a couple of hours.
That's wonderful.
If not sooner.
How about if somebody's in the hospital? I know sometimes they want to just hire somebody to sit with them in the
Absolutely.
hospital because they feel like the family feels like the nurses are not on top of things. So you provide caregivers
We do
there as well?
provide care. Yeah, and actually, my mom was in the hospital, and she was actually told to hire somebody privately because the ratio is low in the
Yes.
hospital. So if the client is going into the hospital and they want somebody, then we absolutely have caregivers that can come and spend the whole time that they're there. The only time it's an issue is if they have long-term care insurance. If clients have caregivers in their home and then go into the hospital, the caregivers can absolutely go right with them.
Oh, that's good. I
Which
was
is
gonna ask
good.
you that.
If you know somebody and you have somebody already with you, that caregiver can most definitely go right with you. Long-term care insurance doesn't cover care in the hospital, but privately the client can still take that caregiver with them to the hospital. So
That's
they have
great.
that continuity.
You must have a huge staff.
We do. The majority of our people are independent contractors. We have a lot of people that are working currently.
And they're on call 24/7.
Right, and we have a lot of people that are just registered that work here, there. We have a lot accommodate. The good thing about us is that we can accommodate a lot of schedules.
So what's the difference between a home health agency and a registry?
The main difference, really, our caregivers are independent contractors. Agencies hire employees. And so when you hire an employee, sometimes they have to work, and you're paying them whether they're working or not. So
Right.
the cost could go up. Our caregivers are independent contractors. They set the schedule that works for them. I have a lot of nurses that work when their children are at school.
Right.
Then they can go home. They can pick and choose, which allows the cost to be less for the consumer. So they don't have to pay for all the overhead. But the main reason I would say is agencies do the higher skilled level cares, the physical therapy, occupational therapy, and then the registries concentrate more on the custodial everyday care.
So what is a health services pool?
CSI has a health services pool, which is a statewide contract that we have that is overseen by ACA, the Agency for Healthcare Administration, as are all our licenses. And what that does is it allows us to staff medical entities with physicians, physical therapists, occupational therapists, as long as personal caregivers in the hospitals, like we do with some of the major hospital systems here.
So do you provide backup coverage? What happens if somebody gets sick? You provide somebody to
Yeah.
fill in for them?
We have people waiting, and that happens all the time.
I'm sure.
Caregivers get sick, caregivers' children get sick, caregivers' parents get sick, and so we always have a standby, somebody that can come in, and sometimes
moment's notice.
At a moment's, that's why we're 24/7, because
Right.
people get sick. Unfortunately, not 9 to 5. They get sick, caregivers and clients, all
Right,
the
and
time.
of course you can't go to your client sick.
No.
Because they're typically the
No,
elderly.
and we don't want them to go
Right.
sick, and nor should they go sick. So if they're sick, they call us. That's why the 24-hour center. They can call at 4 in the morning. We're already prepared to have somebody ready to go when their shift is about to start.
Wow, that's
Do
perfect.
you have clients with Alzheimer's too? Do you work with Alzheimer's?
Absolutely. We have a lot of, unfortunately, again, we have a lot of clients with Alzheimer's. We have caregivers that have experience with Alzheimer's. And that's part of the matchmaking, right? The matchmaking is not only the language and the culture, but it's the experience. If your mom has Alzheimer's, I'm going to try and find you somebody that's had years of experience with Alzheimer's, because it's difficult sometimes, and so they have to be sensitive to the Alzheimer patient.
So they would have to stay in the home most of the time with the Alzheimer's patients.
And we do have that. We have caregivers that are there hourly, which is whatever the hours are during the day or night. And then we have a lot of caregivers that do what we in the industry call live-ins, which is somebody that moves in to your home and is
Wow.
available for waking hours. They're sleeping at the night, hopefully, maybe 1 or 2 times if the client gets up. It's very cost efficient that way. They're not charged an hourly rate for 24 hours of care.
That's great.
They're charged for the day.
I didn't even know that was available.
Yeah, it's a real, and it's probably because not a lot of people have these caregivers that will do that type of work. CSI is known for that.
Wow, God, there's
That's
just
incredible.
Now you brought up hospice. Do you do hospice work also?
We do hospice work. We do a lot of subcontracting through hospice companies within the whole state. Hospice, like we were talking about employees earlier, if you don't have work for all the employees, it's costly to keep them all on staff.
Oh, exactly. Yes.
So what they'll do is they'll contract with us, and then we'll supply them with the caregivers, and then they don't have to. They pay just as they're needed.
So that's whether they're in a hospital facility or a home.
Hospice could be in either. There's
Yeah.
hospice houses, as
Right.
they call them, and then there's people that just stay at home.
I want to give everybody your website address. You have got a great website. There is so much great information on there. I think I spent like 30 minutes the other day just
Yeah.
looking through your website. What's your website address?
It's www.csiccaregiver.com.
And if they were watching right now, they would see it's right on the screen.
Right.
But it's a great website. It's so easy to see that you guys really know what you're doing.
They have great articles. There's a lot of blogs on there with a
Yes,
lot of really
yes,
good
I saw
information.
those. I mean, it's just if you're in the market for mom or dad or your grandparents, this is a very reputable company. You can see. I mean, they've done so well. They've other markets, which that's one of the things I look at, because the ones that fail,
Right.
they're sure not going to be in other
Well,
markets
the fact that
either.
you pick up the phone 24/7
Right.
is huge,
Right.
and you have a live representative.
Right.
It doesn't get any better than that, really and
No.
truly.
No,
Yeah, plus other companies come to you to help with their staffing.
Right.
So that right there tells
Speaks
a lot.
volume, yeah.
yeah.
Right.
Last year we serviced over 6 million hours of care to
Wow.
clients.
I'd say you have a little bit of
It's a lot of.
background in home care,
We've been doing
That's
it a while.
incredible.
because we do a show in other cities, and home care again has become so competitive. There's so many out there, but there aren't so many good ones out there. So that's again what the purpose of the show. Here we have a wonderful company. Again, let's give them your phone number again too.
It's 877 caregiver.
Well,
That's easy to remember.
Right, caregiver.
and they're going to be with us every month. That's what's really wonderful. So every month, and of course we will let you know when they're going to be back on again in October, and we're going to talk about more home care talk.
Give your website again for people that want information or want to contact you through the website if they have a question.
Sure. www.csiccaregiver, caregiver.com.
Perfect.
So we're going to go to break. Thank you so much for coming
pleasure.
in.
Thank you, Nina.
They sent a great representative, let me
Thank
tell
you.
you. We've got a great second half hour. We've got
We have John Elias, family attorney.
one of the top family attorneys in South Florida coming on with us, and we will be right back.
Thank you. Now we.
CareGiver Services is the most trusted name in caregiving in South Florida. CareGiver Services offers skilled nursing, assistance with activities of daily living, shower or bath visits, meal preparation, housekeeping, companion homemakers, live-in care, special needs, and many other areas of home care. Caregiving Services also provides care for Alzheimer's and dementia patients, as well as transportation for doctors' visits. Caregiver Services conducts extensive background screenings, including Level 2 background checks. Caregiver Services accepts long-term care insurance and Medicare. Contact Caregiver Services today at 800-282-6409 or go to their website at CSICareGiver.com. Trust the care of your loved one with the home care company that so many trust. That's CareGiver Services, where caring comes first. Call them now at 800-282-6409 for peace of mind.